Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and this is Dr. Melinda Morris, and she's giving us some great information that will help the women and the whole families, as a matter of fact, move through the menopausal time, because this is not just something for women, but it affects the whole family. And in looking at this chart, that's one of the first things you ask the people to, the women to fill out when they come in. Under the testosterone deficiency, you have things like incontinence and heart palpitations and thinning skin. That was one of the things that I noticed about myself, is how thin my skin got.
Yeah.
And so do you ever have someone, you said you had a lot of people that came in and checked every box under all of the 5 categories, but do you have anybody come in that's primarily just in one area or the other?
Oh, yeah. And, you know, every woman has her own set of symptoms, and each woman has to be addressed individually. Each woman has her own level where she feels good. And there's a wide variety of hormone levels. If you measure an estrogen level on a blood test, the lab will tell you that the estrogen level is normal anywhere from a level of 32 picograms per deciliter up to 425.
Wow, that is a huge
That's
difference.
a huge range. And there's a big difference between having an estrogen level of
32
and 400. And women will come in and they'll say, well, my doctor said my estrogen level's normal, but I'm having all these symptoms. And I have to explain to her that, you know, normal is considered such a wide range that's why she could be told that. But in your 20s, you know, you've got estradiol levels in the 200 to 300 range, and then that gradually starts to decline. Once it gets below 30, that's the menopausal range. And when I talk to women about hormone replacement therapy, I'm not necessarily trying to get their levels back up to where they were at 20. But at least to the point where it's controlling and managing their symptoms.
So it's more in balance, even if it's less, it's still more in balance.
And, and some women will feel good when they've got an estrogen level of 80. Other women need a level a little bit higher. So you have to tailor the treatment to each individual woman.
It's not like, here's a prescription, now go take it and hush.
Definitely not. And that's why some women are on hormone replacement therapy and still symptomatic because that particular dose isn't correct for them. So no, there's not a one-size-fits-all when it goes to hormone replacement therapy.
So what I'm hearing you say is that a woman doesn't have to go through all this hell that women used to have to go through, because there is a way to control these symptoms that are such an onslaught.
And I have to do a lot of counseling, because back in 2002, the Women's Health Care Initiative studies reveal the risk factors for hormone replacement therapy, and that's when the big scare came out of being on hormone therapy. And so I have to do a lot of education to women. I have to discuss the benefits and the risks that are involved. And it's each woman's individual choice to decide whether she wants to consider hormone replacement therapy or not. 200 years ago, the average life expectancy was 48 years. So 200 years ago, by the time women were going through menopause, they weren't living beyond that age much longer. Now, the average life expectancy for women is 85, and you're going to spend a third of your life in the menopausal state. So what I explain to them is, you're basically at the fork in the road, and you're going to take one path with hormone therapy, one path without hormone therapy, and basically your quality of life is going to be different depending on which road you take. But since women are living at least 30 years within that menopausal stage, it has a huge impact on their quality of life for the next 30 years.
I know.
Yeah.
And it should not be that they can't afford it, because there's too many women's clinics and other things that they need to go see about it.
And there's so many different treatment options. You know, so we go through the risks and benefits of each different treatment options, the potential side effects associated with one versus the other. So it takes quite a bit of time, and you have to have a physician that's willing to take that time to spend with women so that they really understand what's involved, what their choices are, and they can make good choices about their health.
Yeah. Well, one of the things that I noticed on here is things like low libido is on 2 or 3
Yes.
different areas. You may have a low testosterone, or you may have low estrogen, but both of those would be affected, affecting your low libido.
Yeah, and even thyroid function has an effect on libido. So when you're looking at the hormone status of a woman, you're looking at the ovarian function, you're looking at her adrenal function and her thyroid, because all 3 of those different hormone systems work in balance with each other. And you know, so many of these symptoms overlap, and that's why you have to do all the hormone testing to find out for sure where the issue is. You know, does she have low thyroid? Is she in an adrenal fatigue state, or is she truly becoming menopausal? So you've got to address all those different issues. And women are a lot more complicated than men when it comes to libido, and I do a lot of counseling on that as well. You know, men are about the testosterone, but we're a lot more complicated than that. And there's actually
We've got a lot more screws in our system, don't we?
We do. And there's actually 5 different hormone levels that are involved in maintaining libido for women. You know, so just giving a woman testosterone is not a quick fix for her. So we do a lot of counseling on that as well.
We're going to have to end this program today, but Dr. Morris is going to be back with us next Sunday, and we're going to continue this discussion. And I want to remind you that Dr. Morris is not only a teaching fellow at Texas Tech University Health Science Center, but she also has her private practice, and the number is rolling across your screen. So certainly give her a call if you've got, if you'd like to see if you need an obstetrician or gynecologist, because she can help you with this. And we'll be back next Sunday with another program. Thank you so much for joining us today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.